Now, within the last few minutes, the French President Emmanuel Macron has announced that France and most European Union partners will close their borders to non-European countries for 30 days from tomorrow at noon. At the same time, the movement of French citizens will be strictly curtailed for at least 15 days. Only essential travel will now be allowed in France, with infringements sanctioned. Our Foreign Affairs correspondent Jonathan Rugman has this report.
In France, the spring sunshine lured many Parisians outside, in spite of the government urging people to stay at home. It's also ordered non-essential shops, cafes and restaurants to shut, apart from those delivering takeaways. Schools and universities are also closed, and the second round of local elections has been postponed until June, which begs a question as to why the first round went ahead yesterday. And the panic buying here is driven by an assumption that a total lockdown, Italian style, is next.
It looks like the army's going to be called in. It's going to be like Italy. It'll happen the same way. No one will be allowed out. I'm convinced of that. So we'll try and work from home, tell people to go home, stay positive, and not start panicking.
In neighbouring Italy, they need no warning. Italians are notoriously not the world's best cures, but the virus has changed that. Nowhere is the daily death toll higher. 368 yesterday, 349 today. And the government says the outbreak has not reached its peak yet.
I believe that in this kind of situation we must be compliant and orderly. I see that people are reacting positively. I hope that it will end soon, because I am exhausted.
Yesterday, the Pope ventured with his bodyguards down the Via del Corso into a largely deserted Rome to pray before a crucifix dating back to the plague of the 16th century. Next month's Easter services in the Vatican will not be open to the public, with St. Peter's Square and Basilica closed.
Let's keep praying for the sick people. I think about families under lockdown. The children not going to school. Maybe the parents can't get out. Some of them could be quarantined.
With much of Italy's economy slowing to a halt, there was one pleasant surprise in the canals of Venice. Fish swimming in clear, bright water, now that the polluting traffic from ferries, motorboats and cruise liners has sharply reduced. In Spain, the epidemic appears to be spreading at its fastest rate. In Madrid last night, the army was enforcing a lockdown. With almost 300 dead, Spaniards can only leave their homes for specific purposes. The country's health system is overwhelmed. Spanish police entered a factory in the south of the country to seize 150,000 surgical masks. So urgent is the demand from hospitals in the capital. With the EU now mulling whether to close its external borders for 30 days, the Germans have reintroduced their own controls, closing their frontiers to non-essential travellers. Commuters from France found it quicker to cross into Germany by foot rather than by car. Though Europe's biggest economy insists that cross-border trade is continuing. Schools have been closed in Germany until the end of April, and this afternoon Chancellor Merkel ordered most non-food shops to shut, along with a list of venues, including bars, theatres and children's playgrounds. Back in Italy, Europe's epicentre, this is a vision of what could follow. Not just hospitals, but cemeteries struggling to cope. This one is in Bergamo in Italy's north, where the undertakers must wear masks and gloves, where the car park is full of hearses, with grieving relatives only allowed in small numbers and required to stand apart for safety.
Well, as we've been hearing, the government has just stepped up its measures to stop the spread of the coronavirus. But even before today's announcements, many businesses had started taking action to protect staff and customers, and some parents had already started keeping their children away from school. Fatma Manji has been speaking to them.
A drastic protest designed to grab the attention of lawmakers in Westminster. The newly formed protest group Pause the System donned hazmat suits for their sit-in outside Downing Street. They want the government to take faster and deeper action, with demands including sick pay for all workers and a universal basic income.
What we need is to pause the system. We need to go into lockdown to give us a break from this economic system that's crippling us and the planet.
Before the government changed its advice to encourage people to work from home, this morning many had decided to take steps themselves. Central London felt almost eerily quiet in parts. And across the country, some parents chose to keep their children away from school. We've learnt in one English county alone, 20% of pupils didn't turn up.
This morning I emailed his school to say that we would be keeping him off indefinitely. Our reasons for doing that are because we have zero confidence in the government's plan. I recently finished cancer treatment. My husband is asthmatic, and we both care for a high-need disabled child.
It's a really scary time for parents, but my biggest advice would be to just go down the health route and making sure that I'm building up my children's immune system by serving lots of fruit, veg.
And I'm just not prepared to take the risk of my child going to school and potentially picking up this virus.
Those who run businesses centred around children say much more guidance is needed.
It is very confusing. I think childminders are finding it very confusing. Obviously going forward, children need somewhere to go. I think, but we're not really sure what will happen if schools or nurseries shut down. Will that affect childminders?
Some small businesses are finding creative ways to continue working from home. Yoga instructor Sam Roy has closed her classes, but is now teaching meditation via video links.
There are plenty of online platforms where we can easily meet, the community can still gather. They can share their experiences, do breath work together, meditate.
Others are still hoping they can continue as normal, while introducing steps to keep staff and customers safe. This South London cafe has gone cashless to keep contact minimal.
We've actually moved away from using all of our ceramics and cutlery in store, so now we are using just the bioplastic cutlery that's disposable, as well as paper cups that are also disposable. We've done this so that there's no cross-contamination possible.
But how long can normality continue? The scenes at Downing Street this morning may have been a theatrical protest, but the fears felt around the country are real, and many are demanding much more clarity.
Fatima Manji reporting. Well, now, there were no enforced quarantines announced earlier and no orders to close premises. But the advice was clear, a request to the public to do something difficult, disruptive. The Prime Minister described the steps the public is now being asked to take as draconian. Here are some of the key public health measures announced by Boris Johnson at this afternoon's press conference.
Last week, we asked everyone to stay at home if you had one of two key symptoms, a high temperature or a new and continuous cough. Today, we need to go further. If you or anyone in your household has one of those two symptoms, then you should stay at home for 14 days. That means that if possible, you should not go out even to buy food or essentials other than for exercise, and in that case, at a safe distance from others. Now is the time for everyone to stop non-essential contact with others. We need people to start working from home where they possibly can, and you should avoid pubs, clubs, theatres, and other such social venues. We should all only use the NHS when we really need to, and please go online rather than ringing NHS 111. As we advise against unnecessary social contact of all kinds, it's right that we should extend that advice to mass gatherings as well. This advice about avoiding all unnecessary social contact is particularly important for people over 70, for pregnant women, and for those with health conditions, with some health conditions.
Well, now I'm joined here in the studio by Dr. Bharat Pankhania, a clinical lecturer at Exeter University and a former consultant at Public Health England. And from Beaconsfield, we have Professor Karol Sikora, who was chief of the cancer programme at the World Health Organization and is now Dean of Medicine at the University of Buckingham. And in Westminster, we have Dr. Dominic Pimenta, a frontline NHS doctor and cardiology registrar. And inevitably, we're going to come to you, Dr. Pimenta, first. And I'm wondering what your reaction as a frontline operative right now, dealing with people coming in every day, what you feel about today's measures.
That's a great question, John. Thank you very much. So the reason I'm here today predominantly is because this morning and this afternoon we've published a letter from 1,200 NHS frontline staff who are calling for the government to take drastic measures to reduce the amount of cases coming into hospital as small as possible so we have the capacity to cope. The measures announced today are a step in the right direction and somewhat vindicating our concerns, but they don't go, in my opinion, far enough. What we need to do is achieve the amount of cases coming in that we can safely deal with. Already we are running out of protective masks and goggles, and the crisis hasn't really even begun yet. There's a long-term shortage of ventilators and even of oxygen. What we need is time to prepare, resources to protect ourselves, and we need to return to the World Health Organization recommendation of mass testing so we can reduce the numbers as much as possible and save us time, because that is the key thing that will get us through this. We don't have the time to prepare and we're not ready.
Professor Sikora, what's your reaction to that reaction from the front line?
I think that's a reasonable reaction. The difficulty is the practicality. If you really do really draconian measures, close everything, absolutely close, prevent people getting out of their houses, especially those at higher risk, people with comorbidities, multiple illnesses, and elderly people, it'll be difficult to police. So it's got to be a reasonable balance. And I think what we've heard so far has been great. I was very worried on Sunday morning when I heard that the over 70s, I'm 71 myself, were going to be essentially cocooned. I think this is unnecessary. One has to be reasonable. What one's trying to do is increase the disease burden, as we've heard on the health service, by allowing people that are more likely than not to get into trouble if they get infected. People with pre-existing heart and lung disease, people that have other problems. They're the people that really need to be careful. And remember, a healthy 70-year-old is probably at lower risk than an unhealthy 50-year-old. So age is not a good criteria here as the only criteria.
Dr. Pankhania, then where are you on this?
I'm with a bit of both, with both my colleagues here. But what I would say is this. Clear messages need to be sent to the at-risk groups. Professor Sikora has identified that you can be lower than 60 years old and have at-risk conditions, and this needs to be articulated clearly. And people like myself, many of my colleagues have been talking about, the clear messages that need for people who need to isolate and isolate as soon as possible. On the subject of testing, we're very concerned because by not testing in the community, we're losing precision on our cases, our knowledge of the cases, and maybe identifying specific hotspots and a lot more other things besides.
Well, now, let me just ask you then, Dominic Pimenta, because France on Wednesday is going to actually lock people in their houses effectively. It's going to order people to remain indoors and for 30 days. Is that what you want here?
I want to hear that the government is taking any measure, and by that I mean any measure, that will reduce the number of cases coming into hospital. And we're talking about a virus with a 2-week incubation period, so anything we do today will not have any effect on the spread for another 2 weeks. We have to bear that in mind as the cases rise exponentially. The government could be doing a lot more, not only banning mass gatherings, but actually enforcing that ban, not only asking for self-isolation in a few weeks' time, but today, but also providing infrastructure to make that self-isolation sustainable, making sure that there's elderly care, there's food deliveries. They need to do a lot more, almost on a wartime footing, to support that, to actually be feasible.
As you are on the front line, I mean, just give us a sense of what is confronting you every day.
So it's gone rapidly from everybody being almost sceptical that this would even happen, to suddenly it happening straight away. It's been very, very sudden. We're trying to make as much as we possibly can on the front line, preparations, and literally plans are changing every single day. As I said, we're already running out of the basic protective kit for us as NHS workers, which is our main concern. And if we start losing frontline staff in a country where we already didn't have very many frontline staff, and we haven't organised any more frontline staff, we're going to run into trouble very, very, very quickly.
Professor Sikora, is this thing under control, or are you concerned that it is out of control?
No, I think it's under control. I think we'll get through this. By June, it'll get a lot better. The evidence from China and Korea is that it's not great there in either country, but it's got a lot better in the last week than it was before. And I think the same thing will happen in Italy, France, and then us. And we have to get through it. And
you've mentioned Korea in particular, which seems a very, very interesting example, but it's very difficult to tell why they've been so successful.
I guess because they're better organised than we are. And, you know, do the health service, some countries have more capacity in the health service than we do. We don't have that capacity.
What do you make of it?
I'll tell you, while Korea has succeeded, it did extensive testing, extensive restriction of movement early on. As soon as it happened, Korea went for it and said, we're going to test, we're going to identify who is at risk, and then you stop the contacts of the cases.
That assumes they had the testing kits and the rest of it. We seem to be short of testing kits,
no, we are not,
short of ventilators, short of more or less everything.
We are not short of testing kits. We may be short of other things. But my main point is this. If you stop the rising tide, you will create fewer cases for my colleague over there to handle. That is all I'm saying. Please lower the rising tide of number of cases. And therefore, whilst we may be saying draconian measures for people to go into isolation in the at-risk groups, it is a good thing because they are the ones who are most vulnerable should they get infected.
Thank you very much indeed. Well, thank you, Dr. Pankania. Thank you, Dr. Sikora. And thank you, Dr. Pimenta. And good luck on the front line. Thank you.
Thanks, John. Well, as COVID-19 continues to spread in the US, most states are closing schools, and the Centers for Disease Control and Prevention has told people not to gather in groups of more than 50. The Federal Reserve made the dramatic move to lower interest rates to near zero yesterday, but the markets did not respond well, with the Dow Jones having to stop trading immediately on opening once again this morning. In the past half an hour, President Trump has been speaking to reporters, and Siobhan Kennedy is in Washington, D.C. for us now. Siobhan.
Well, Kathy, the president is still talking. I will give you some of his headlines in my scribbled notes here. He has urged in the last 10-15 minutes Americans to restrict their gatherings to 10 people or less. That is shock news here. Yesterday's advice was 50 people. Today, the president has made that 10 people, saying it's the only way that we'll be able to control this epidemic that he referred to as our invisible enemy. And he's warned Americans for the first time that these types of drastic measures could continue, Kathy, until July or August. This is the first time we've had these types of admissions from the president here. When he was asked also about the economy, he said that he did believe that even though the markets were going very clearly sideways today, that there would be a lot of what he called pent-up demand once this all goes away. But also he admitted for the first time, Kathy, that America may be, he said, may be headed into a recession. Of course, it's that fear of recession that saw the Fed cut rates last night in an emergency surprise move for the second time in a week, and also pump billions and billions into the financial markets to keep the banks lending, that so-called quantitative easing that we saw and heard so much about during the financial crisis. Of course, they made all these moves too during the financial crisis, but they did so over a 17, 18-month period. It says something about the seriousness of where we are at in the world and here in the US, that the Fed has made this same moves now, but over the state of 1 weekend, 1 week, and also that they have had very, very little effect.
A shutdown in the city that never sleeps. Times Square in New York, one of the busiest tourist destinations in the US, reduced to a ripple of foot traffic and passing taxis.
As cases of the virus soar, the city has closed its schools, ordered all bars and restaurants to shutter, and is recommending a curfew post 8 p.m. A curfew in New York City, a vision of a dystopian future never seen before, even after 9/11. And across America, in the absence of central guidance from their president, governors take matters into their own hands.
I want federal guidance. You can't have one state taking actions that are different than other states. This is a national pandemic, and there are no national rules.
And there are no national rules, in part because of one man's confusing response.
And so far, we have lost nobody to coronavirus.
The risk to the American people remains very low. A lot of people think that goes away in April with the heat. It's going to disappear. One day, it's like a miracle. It will disappear.
Now the Democrats are politicizing the coronavirus. And this is their new hoax.
In the space of just several weeks, President Trump has gone from dismissing coronavirus as a hoax that will just disappear.
Be calm. It's really working out.
To having visitors' temperatures checked as they enter the White House grounds. Far less order as Americans landed at Chicago's airport over the weekend. Just as a nationwide ban was introduced to prevent crowds of 50 or more from congregating, so Americans returning home were forced to do just that, standing for hours shoulder to shoulder, creating a potential viral hotspot as they queued for screening. The mayor had a few choice words for President Trump.
If you do not listen and you do not bring us along on the journey first, where we can give you constructive input on how those directives will actually be playing out at the local level, you're going to see more disasters like last night.
Large groups of people are prohibited from congregating together.
In New Orleans, police drove through the tourist mecca of Bourbon Street, telling crowds their actions were jeopardizing public health. And in Florida, Disney World, nicknamed the happiest place on earth, became one of the most deserted, as Mickey and Minnie closed their doors for the next fortnight at least. But the message of containment hadn't registered with these elderly Florida residents and die-hard Trump supporters. Despite their age group being the most vulnerable, they still believe the president has everything under control.
I really believe in him, and I love what he's doing. I love that he's so strong against everything that comes at him.
As worries intensified that US hospitals could soon become overwhelmed, there was one glint of hope. In Seattle, researchers working on a COVID-19 vaccine began injecting shots of the serum into volunteers for the first time. But even if the tests prove effective, the public urged to remember a vaccine won't be available for widespread use for 12 to 18 months.